Hello everyone, Kevin from Innovative Nurse. I wanted to raise my voice today on an issue that came to my attention just a few short days ago about a fellow nurse and patient advocate, Amanda Trujillo from Arizona. Now, if you've been following Innovative Nurse, then you're probably aware of what's going on. I have placed links below on the YouTube video here, and if this video is embedded in another blog site, hopefully you're aware of what's going on. Now, as a fellow nurse and patient advocate, I understand what we do, the effort that we put forth to ensure that our patients are making well-informed decisions about their plan of care. Amanda's story begins when she was working a shift at the hospital and a patient was getting worked up for transplant surgery. Now, Amanda, assessing that her patient had a knowledge deficit about this type of procedure and plan of care quickly realized that her patient needed further education. So, using the hospital's resources, Amanda had a dialogue and, as a nurse, educated her patient. It also seemed to surface that the patient had questions about alternative options. Now, in a transplant situation, sometimes these end up really just quickly transitioning into hospice care. So, Amanda, using the hospital's resources, requested a case management specialist to come in and help educate the patient and potentially coordinate this type of care. Ultimately, the patient did not choose the transplant. And so this quickly became a fairly emotional situation. Apparently, the physician was extremely upset, not just because the patient chose not to do surgery, but also for Amanda's involvement, because maybe the assumption was that she had a hidden agenda. And so, working within her scope of practice, doing what nurses do each and every day, she was fired. And her license is now up for review with the Board of Nursing in Arizona. All for doing something that is well within her scope of practice and working with great integrity. I am here today for you, Amanda, but I'm also here for something much larger. A patient's right to choose. You see, it doesn't matter what type of healthcare professional you are, what credentials you have after your name, whether you're a nurse, a doctor, a dentist, a physical therapist, because ultimately, our patients are at the top of this hierarchy, and the balance of power should always shift back to them. Now, I don't want to make this an us versus them kind of situation. And I'm talking to all of you healthcare professionals, no matter what specialty you're in, what license you hold. It's not about that. It should always be a team, a collaborative team. And it's all of our jobs to use our clinical skills and our knowledge to educate our patients. It's our responsibility to protect the rights of our patients, to choose what they feel is the best treatment after having all of the information. Amanda, I want to thank you for advocating for your patient and for standing firmly for us as a profession. You helped fuel our Nurse Up movement. You see, Amanda brought our communities together, and I ask you to join our efforts, not just for her, but also for nurses who work with great integrity to uphold a patient's right to choose. Our social media platforms are bursting. We have various blogs out there, Facebook pages, Twitter feeds, and a petition for Amanda. You can find all of the necessary information at the bottom of this video. Search Twitter for #NurseUp, or go to the directory at nursefriendly.com/Amanda to find us. Help us raise awareness and empower nurses to join us on the front lines of this cause. Nurse Up.